Thank you, Dr. Mayra, for the invitation to present and to be part of this meeting. And thank you to all of our partners for being here, both for taking time out of your days in Abuja and traveling from all over to be with us for 2 days. This is really a great opportunity. So I want to say up front that I'm hoping this will be much more of a discussion. I have a few slides to walk us through, but would really like to pull from all the expertise in this room and hear from you, who are, as we've heard by other speakers, you who have boots on the ground, so to speak, and much more expertise than I do, and would really like to just set this up as a conversation. So, as Mayor laid out today, we want to focus on equity and understanding with all of the programs that we're doing, are we reaching the people that we are hoping to serve, those who are most vulnerable and who can benefit most from the programs that we're implementing. So I'm going to move to the next slide and just set up a couple of so again, this very brief presentation will be just setting the context for the panels to come this afternoon. As you know, the Gates Foundation will present an update on various programming strategies and their view of how to ensure an equity lens through our programming. So this is just setting the stage for that. My expectation is that we'll have lots of questions and comments, reactions from our partners who have a different perspective and have perspectives across various programs. So, I start out with the question of why is equity important? I would guess that all of us in this room are in the work that we do because we believe fundamentally that equity is important. I want to introduce the Countdown 2015 MNC.org website as a resource, as a tool that we can pull from, that the Gates Foundation has been working with different partners as part of the Countdown work, counting down to the Millennium Development Goals. The rationale is improving equity is essential for achieving the MDGs, which we know are rapidly approaching the end of, and we will be turning to the Sustainable Development Goals. What Countdown aims to do, I think I'm moving my slides accidentally. There we go. So why is equity important? Looking at data sets, national statistics often highlight important inequities. Measuring inequities is important due to moral as well as practical reasons. When we look at the role, when we look to define inequity, they can be several dimensions. It can be gender, it can be education, it can be geography, ethnic group, a variety of different definitions. In the most disadvantaged groups are mothers and children, who are less likely to receive preventive and curative interventions, and as a result show higher morbidity mortality. And equity is central to the Countdown and accountability in general. The Countdown aims to promote increased coverage for the population as a whole, but also ensure that disadvantaged groups don't lag behind. The Countdown group has a working group specifically focused on equity, which carries out analyses of surveys, for example, the DHS and MIX in priority countries, one of which is Nigeria. And they do breakdowns of key coverage indicators stratified on 5 key domains of equity, including wealth quintiles, maternal education, the sex of a child, urban and rural residents, and region of the country. So this, I'm using this as an example specifically focused on health outcomes. I'm hoping that during the discussion we'll also go into other sectors, for example, financial services, agriculture, water, sanitation, hygiene, other areas where the foundation and partners are working in Nigeria. But on the whole, based on analyses to date of DHS data from 2011 and 2013, we can learn that coverage almost always is higher for richer households. I think that's not new to anyone in this room. But where we see inequities are greatest are for those that require a strong health system. So for example, a skilled attendant at birth. There is an opportunity at the community level where inequities tend to be smaller for those interventions delivered at community level. For example, supplementation with vitamin A or vaccines. Many of you are partnering with us on routine immunization, particularly in the north, and that relies so much on platforms, part of the primary healthcare system, but also engaging traditional leaders and community actors. So what I'm showing here are data from the Countdown Working Group. Cesar Victora and the team based at the University of Pelotas in Brazil shared these with us, and they're available on the website, which you see, countdown2015mnch.org, for all of the countries, not just Nigeria. But what we see here is a wider bars mean more inequality in absolute terms, whereas narrower bars mean less inequity. So the numbers the font is a bit small, but when we look at family planning, antenatal care, skilled birth attendance, early initiation of breastfeeding, insecticide-treated bed nets, coverage with DTP3, measles vaccines, vitamin A, oral rehydration therapy, and care seeking for pneumonia, we see quite some gaps between the poorest 20% and the richest 20%. And these are based on DHS 2013 data from Nigeria. The next chart is co-coverage of health interventions. This is pulled together from 9 different indicators that I had just called out on the last slide. And what this shows is the colored bands are showing the proportion of children in each wealth quintile that received a given number of interventions in Nigeria. So to summarize, the purple part in Q1, the poorest quintile, shows that nearly 40% of children received 0 of those interventions in the poorest quintile, whereas moving towards the right to the highest quintile, the richest 20%, you see far more children receiving more of those interventions. So when we're looking at delivering a package of interventions, how many children are actually receiving the whole package versus 0 or 1 of those interventions? And finally, this slide shows a composite of coverage. So the red areas are showing the coverage gap, which you can see is substantial to the left in the lowest quintile. This could be interpreted as the population needed to be reached before universal health coverage can be achieved. The blue bars, we see an increasing trend in general with the richest. So in the fifth quartile on the right, you see far more children actually receiving all of the interventions when we look at a composite of 4 domains, including contraceptive, pregnancy and delivery, immunization, and care of childhood illness. So I show you those data to set a picture of what some of the most recent national surveys have shown in coverage of interventions with an equity lens for Nigeria, specific to MNCH. But a question that I'd like to pose to the group is where is equity being pursued in creative ways in Nigeria? I've listed here 3 different programmatic areas that I think are good examples. I would love to hear input from those of you in the audience as to where other programs are pursuing new ways of working. One example is polio, which you all know is one of the main priorities of the Gates Foundation, and really exciting to see that last week Nigeria successfully marked 1 year without polio. The strategy included highly targeted, data-driven planning, well-trained and motivated staff, rigorous monitoring, effective communications, mobilization of trusted community members and religious leaders, political will at all levels, and adequate funding. all of those went into ensuring equitable coverage of polio. The Financial Services for the Poor, or FSP, team is looking for strategies to get women more actively using digital financial services beyond payments. And finally, with MNCH, I've just shown one of the examples of the work that MNCH is doing with the countdown. But the approach that the team is using in Gombe includes a systems approach using both supply and demand and reaching the poor, trying to address some of the indirect social determinants. One area I'd like to call out before closing is a new focus that Melinda Gates, one of our co-chairs, has taken a stand on and has challenged us to think differently and to challenge gender norms more deliberately. She wrote an article that appeared in Science magazine almost a year ago, and I'll just read what's on this slide, which says, "Smart development intentionally addresses gender inequalities and measures the impact of health and development programs, not only on sector outcomes, such as contraceptive prevalence rates, agricultural productivity, or access to digital financial services, also on gender outcomes, making power, shared control over assets and income, personal safety, mobility, and equitable interpersonal relations." So this is the guidance we have from one of our co-chairs of how to work across sectors and find ways to integrate equity into all of our programming. And we can only do that with our partners. So I'm going to close with a set of questions.